Well, this morning on Good Day New York, our colleague Mike Woods revealed that he is undergoing treatment for prostate cancer.
All right, tonight he shares his story in hopes of helping others make smart decisions about their health.
Before you learned of your diagnosis, what did you know about prostate cancer?
Well, in my family, my grandfather had it back in the 70s. My father caught it in himself when he was 59. This is back in 97. And so I knew that I needed to look out for it. So other than that, I just knew, you know what, you needed to make sure you got yourself checked on a regular basis. I figured it was going to happen somewhere, around 50 or so before I'd have to really start checking into it. But I know that when it came down to my family, it usually didn't present until closer to 60.
And what happened to your grandfather and to your father?
In my grandfather's case, they caught it very late. Again, I think this is mid to late 70s. So by that time, it had already gotten out into his system, and there really wasn't much that could be done, and he died fairly quickly.
Sorry.
Yes, with my father, his situation was he was about to retire. He was 58 years old. He had his check, and I guess, I'm not sure if it was a PSA or what, somehow they found it, and they felt it was quite early, but because of the family history, they decided to remove the prostate. Unfortunately, within a few days after the surgery, he passed away. He had what we believe to be is a massive stroke from a blood clot that broke loose. So
not good luck with this diagnosis.
Right.
Any other male family members with prostate cancer?
My uncle, a year later, and he's also my dad's little brother, a year later, the exact same thing happened. So this now really is raising all kinds of red flags with me.
Exact same thing. He had cancer, he had the surgery?
He had cancer, he had the surgery, and he had a blood clot break loose, and he passed away from this.
Oh my goodness.
Yes, yes.
You've had 3 direct relatives, the closest men in your life, genetically, all died related to prostate cancer, one way or the other.
Exactly, and a cousin as well, but now he actually had the prostate removed. This is only about a year ago. He's still alive, he's doing well.
So with all this history, you decide appropriately to get checked, and a lot of men wouldn't.
Right.
But you didn't want to run from the
I didn't want to take a chance, exactly, because obviously this runs, in my family. I didn't think if this was going to be a problem, it wouldn't happen until I was closer to 60, especially I'm probably the healthiest of the men in my family, period. But you just never know.
I'm really happy you're being public about this, because there are a lot of men who would have done something very different. So let me just speak to you as a friend on this.
Yes.
I'm one of the most conservative folks out there when it comes to prostate cancer, and I do believe we over-operate sometimes.
Okay.
And a lot of my friends who are in that space will agree with what I'm saying now, which is that for most men, you want to know your number, your PSA, but you don't want to act on it. You just want to know the number, see where you are. If it's an infection, treat the infection. If it's abnormal, check it again, wait over time. But when it comes back as high as yours came,
right,
and the Gleason scale on the biopsy comes back as toxic as yours is, as malignant, as bad as yours is, it makes the decision easy.
Yes.
All the guesswork goes away. I don't think you're going to find real experts in the space who are going to advise you anything other than what you're going to do.
Okay.
Which is to have it operated on. So your biggest trepidations as you get ready for game time. You're an athlete, you've peaked for events before. This may be one of the biggest games you're going to play in.
Right, absolutely.
But in your case, it's true sudden death, potentially.
Well, and it's something that's thrown in front of you, not something that you ever intended on or really had a chance to process. But the good thing about what it is that I'm going through is I think I've got a really strong mindset to know that I'm ready for this battle. And I'm hoping that I can help others, perhaps by putting my story out there, because I think there's a lot to be learned. A lot of folks don't understand how important this is, and it can be deadly. And in my case, it could have been, but we're getting it taken care of.
So I can speak for a lot of folks. We'll all be praying for you. In fact, all of New York, all the country will be praying for you. We honor the fact that you're willing to share your story. Go in there and kick ass, my friend.
Wow.
Brave, it's upsetting. We all found out about this morning. Wow. Well, new prostate cancer screening guidelines call for men to discuss the pros and cons of testing with their doctors.
New evidence suggests that blood tests can slightly reduce the chances of dying from the disease for some men. So joining us now is Fox 5 medical contributor Dr. Devi from NYU School of Medicine. As Steve was saying, we recently found out about this. It's heartbreaking. Yeah. Mike is young, but he has the family history. It's so upsetting. Talk to us about the blood tests and
Well, so the blood test is an old test. This is the PSA screening test. But just to be clear, so for example, with Mike or with anybody who has a family history of prostate cancer or symptoms of prostate cancer, so let's say problems urinating, problems with erectile dysfunction, they don't follow these guidelines. They should get checked out. Okay. These guidelines are only for people who have absolutely no symptoms, no specific risk factors, but just happen to be men that fall into this age range of 55
Right,
and
so to be
above.
clear, like this doesn't apply to Mike's situation, but
Exactly.
this is more for someone who doesn't have this in their family.
Exactly.
Right.
So if you happen to be 55, you don't have any specific risk factors, you can get tested with a blood test called the PSA, which most people right now do. So these guidelines are looking to see whether patients should actually get tested or not, if it's helping them. Now, the issue is that if that number is high, then you have an increased risk of having prostate cancer. It's basically something that's put into the blood by prostate cells. So that could be because you have a large prostate, which can happen to people when they're older, or it could be because there's cancer there that's creating this PSA. So the issue is if a person tests where they have a high number for that PSA, that's not enough to tell us if they have cancer or not. So they typically have to then go on to get a biopsy. Now this task force says that if you're in the age range of 55 to 70, then you should discuss all of this with your doctor before ever getting the blood test, because maybe the biopsy is unnecessary and maybe there could be other complications from the test or the treatment. So this really is just kind of in terms of how we feel, I mean, common sense that we want the patient to decide, right, to discuss the risks and benefits. Some people are definitely going to want to have the test and definitely seek treatment, whereas some people may feel differently. And the guidelines at least say that if you're 70 or above, you may or may not need to have the test because the cancer may be so slow growing that it may not really change things.
Right, how aggressively to treat it's a huge issue with it too, which Dr. Oz touched on.
Yeah, so I would say the bottom line is really the issue is that we don't have a perfect test to diagnose prostate cancer. We have this imperfect test that tells us maybe your risk is slightly elevated, and so as a result of that, you're always weighing one thing versus another. Can we save lives, or could we potentially harm people who are otherwise healthy by doing all these tests? And in the end, the patient has to decide what's best for them.
Yeah, it's a fine line. It's very tricky.
Exactly, but definitely bring it up with the doctor, and if you have any symptoms, then go get checked out.
That's great. He
as
didn't
well
hide
as
from
history.
the likelihood of getting that. He got the test. He didn't want to not know. He found out, and he'll get on it and take care of it. So that's great. All right. Good deal. Thank you, Dr. Devi. We appreciate it.